story time. This 36-year-old male patient was referred to me for a second opinion. This is how the story goes, and this is how and where the story gets kind of weird. According to the patient, he was shown before the root canal. The tooth was crowned. This tooth and this tooth, they were crowned. I'm talking about tooth number 14 right now. Tooth number 14 was crowned, and then later on, patient says he was shown a dark shadow above his tooth and told that the tooth needed a root canal. 1 year ago, so a year ago, a traveling endodontist, they go from office to office, these endodontists, came to his dentist's office 1 year ago and went through his crown and did this root canal. Again, a year ago. Okay. Patient says a couple of weeks ago, he started to have excruciating pain, like severe excruciating pain. And he thought it was the one of these upper teeth, number 14, 15 in this area here, but he wasn't sure. And he saw his dentist, and his dentist prescribed him antibiotics, and in the meanwhile referred him to the same traveling endodontist who had done his root canal through his crown 1 year ago. So patient goes to another office where that endodontist is, another office, and visits that endodontist. That endodontist looks at the tooth, and patient, by the way, patient says by the time he saw that endodontist, his pain had gone away. He had taken antibiotics and all his symptoms had gone away. No symptoms, he had no symptoms at all. So he sees the endodontist who had done this root canal a year ago through the crown. And patient claims that the endodontist told him that the endodontist was very concerned about the open margins here of the crown, and felt that there was leakage from these open margins contaminating his root canal, and his root canal was contaminated. And this endodontist told the patient that redoing the root canal was not indicated. Redoing the root canal was not indicated at this time, and the endodontist had recommended extraction of tooth number 14. So with that information, patient goes back to his dentist to have tooth number 14 extracted, and the dentist says, well, wait a minute, let's not jump at this and extract this tooth right away. Let's get a second opinion. And the general dentist then refers the patient to me, and that was yesterday. The patient came to see me for a second opinion regarding tooth number 14. So, and again, patient had no symptoms whatsoever. Zero symptoms at all. No symptoms at all. So we went ahead and did our tests, and in the meanwhile, I told my front office staff to go ahead and get x-rays from tooth number 14 from patient's dentist from a year ago. Before the root canal, during the root canal if it's possible, after the root canal, all of that stuff, all of those x-rays. And as my front office was working on that, getting those x-rays, I started examining things. Okay. So again, that's why it's so important to do a thorough examination, evaluation. All right. So number 14 and 15, percussion within normal limits, palpation within normal limits, probings 2 to 3 millimeters all around. Looking at the radiographs, yes, you can see open margins here. But look at this root canal though. What is this? If this tooth was infected, as the patient claims it was before the root canal, because the patient, remember, the patient said that he was shown on an x-ray a dark shadow above the root of that tooth, and that's why he was recommended a root canal. All right. So since this patient has no symptoms, I can't really tell if this is an active infection or not. So we have to wait now for the general dentist to send us x-rays of this tooth. What if this is indeed a periapical lucency, what if it was larger and now it's getting smaller? It's been a year, it's getting smaller. Okay. Now, the other thing is that, of course, you should know that you can't just examine one arch, one quadrant. All right. If this patient has problems with the upper left and he thinks he might have, well, you must always examine the lower left side as well. Always examine the lower left side. So, lower left side. At the time, I only had a bite wing of the lower left side. Okay, so that's the bite wing of the lower left side. Well, that's the bite wing of the left side. Again, you can see perhaps maybe a little open margin here, but this endodontist not wanting to retreat his own root canal because he's worried about this, so he tells the patient to go out and extract this tooth. That is odd. That is so odd. That is so unprofessional. That shows lack of understanding of the field of endodontics, dentistry and endodontics, lack of knowledge, lack of experience and expertise. I mean, lack of everything. To just go ahead and tell this patient, a 36-year-old patient, to go ahead and pull tooth number 14. So I started examining the lower left teeth, number 18, with the normal limits to percussion, to palpation, to biting, and to cold. Number 19, percussion, tender. Palpation, tender. Biting, tender. Probings 2 to 3 millimeters all around for 18 and 19. Cold test, no response to cold. There was zero response to cold. So I went ahead and asked my assistant to go ahead and give me a couple of PAs of the lower left side. And here are the PAs. Periapical lucency here. Periapical lucency here. So, patient's excruciating pain might not have even come from tooth number 14. It might have even very well come from tooth number 19. So for this dentist to do a half-ass examination, evaluation, and telling the patient to go ahead and pull tooth number 14 was absolutely, absolutely unacceptable. So by then we had received radiographs from the patient's dentist. These are the PAs. This is the PA of teeth number 14 and 15 before they got the root canals. It looks like they have temporary crowns on them and they're connected, it looks like. No periapical lucencies. No periapical lucency associated with tooth number 14. And none, of course, with number 15. But none with number 14. But patient said, yes, they showed me something on the x-ray before they did the root canal. All right, so let's look at another. That's a bite wing before the root canals. That's the bite wing after they did a root canal on tooth number 15. And that's the PA of the tooth after the root canal, and that's from a year ago. Is that something there? Is that something? I don't know. I don't know if that's anything. They send us another bite wing. That's another X-ray of the PA of tooth number 14. Is that something there? And if that is indeed something, it looks like it's getting smaller. Look at this. This is mid-treatment. It looks like the endodontist is trying to cone fit. Is that something? Right here? Is that what they showed him? I don't know. This tooth may not even have needed a root canal. It may have even very well been tooth number 19 all along. It may have been number 14 and perhaps maybe 15. Both may have been misdiagnosed. And all along, I'm pretty confident it could have probably very likely been tooth number 19 needed a root canal, referring pain to the upper left side. Because I'm not sure if that's anything. And that's again from a year ago. So, see what I mean? If you don't do a thorough examination evaluation, this is what happens. You do root canals unnecessarily. You misdiagnose again, and you recommend extraction of the tooth, when all along, very likely, the problem weren't even these teeth, and all along the problem was tooth number. All along, the problem was tooth number 19. So, here it is. I'm speechless. So I wrote a report to the patient's general dentist. I'm glad they came in for a second opinion. I'm glad the patient came in for a second opinion. I'm glad the dentist referred the patient to us for a second opinion. But extracting tooth number 14, I think, would have been absolutely unnecessary. We can always monitor tooth number 14. If we have to ever redo the root canal, we can easily redo the root canal. I don't even understand why that endodontist didn't want to redo his own root canal and tells the patient some bogus story about coronal leakage and stuff.